People do not meet each other. There's no time to meet and chat. And disconnection is one of the most important reasons. And what is the intervention here? Reconnect. Help children to reconnect with the family members, with their friends. Help them to be in groups. Help them to make friends. Help them to seek help. Help them to share. And these are the two preventive aspects of life. So disconnection plus shame is a suicide cocktail. So reconnect. Let technology, globalization helps us to connect at a distance. In some ways, it is very useful, but the live connect between man and man has been killed. So let us understand that to beat that, we help students to reconnect with a lot of activities inside the college. We help them to reconnect and also break their shame and seek help. One of the most important causes and symptoms of depression is psychomotor retardation, which means I still remember this young boy. I'd gone to a college for a talk, and that college, after a talk, you are showered into a boardroom, and then there are board members and trustees talking good things about the college, and the principal slowly went and whispered in the ears of the chairman, and he said that one student, एक बच्चा college नहीं आ रहा है, 3 महीने हुए, हमने कितने खत भेजे, we have sent so many letters, he's not coming to college, but still nothing. What should we do? Should we remove him from the college? And I heard the entire conversation. I said, you cannot remove anybody from college. Inclusiveness is what we have to practice in our colleges. And we need to find out why. I said, go and make a home visit. And she said, it's not their policy. I said, why are you running the college? It's not in the appointment letters. It's not in the job description. Teachers don't. If teachers start looking at job description, appointment letters, they are not teachers. They are technicians. And I told her, good teachers don't make home visits. Great teachers do. And I volunteered to go to the house of the child who was close by with a teacher. And the principal said, I don't do any home visits. I said, fine, you can sit on your big chair, put the AC on, and talk to the management throughout the day. You can do that. I was angry. And when I went to the house of the child, the father and the mother were very sad. They said, he just is on the bed, doesn't get up. There's no reason at all. I'm working. Financial status is all right. There are no stressors. He has had no affair, no breakup. He's a good student. He's never failed in his class. And I told him, my dear friend, and they have done all the blood tests and the test by physician. I told them this is psychomotor retardation, extreme laziness, as told by ordinary people. And this is not laziness. This mind and the body gets slow, a sign of depression. In 3 weeks, that boy was back in the college. The poor awareness towards mental illness and mental symptoms, the lack of knowledge, and attributing it to manipulation. Jhoot bolta hai. They're lying. They're not disciplined. Destroys the life of students. So this is one of the most important symptoms. Next is psychomotor excitation. Agitated children. Very angry. Gets up at 4 o'clock in the morning and walks, paces up and down, wants to break things in the class. This is not the sign of a bad child. This is a sign of a sad child. Psychomotor, extreme mental restlessness. Lot of thoughts, wanting to harm somebody or harm oneself, breaking things, reacting, anger can also be a sign of depression. It's known as psychomotor excitation. And for adults like you, my dear friends, extreme tiredness, loss of weight, when all the reports are normal, is a sign of depression. My dear friends, in children or adults, depression is very cunning. It can come in many disguises, like Ravan, who came in a disguise. And depression is fracture of the mind. Stress is strain of the mind. What is stress? I failed in my exams, I feel bad. I talk to my parents, I speak to friends, I talk to a counselor, I speak to a psychiatrist, I feel much better. I fail in my exam that I just don't want to do anything. I cannot concentrate at all. I feel hopeless. I feel worthless. I feel I'm a burden to my family. I feel very restless. I feel very lazy. My sleep and appetite is disturbed. I don't feel like being on this earth. Anyone's symptoms, suspect depression and screen them for depression. My dear friends, I need to ask you now only two answers. What do you do when you have pain in the chest? Anybody can answer.
Go to a physician.
And do what, ma'am? Your name and your college and your state.
I'm Elvira. I'm from St. Xavier's College, Goa.
Ah, very nice, very nice. So, and what will he do, the physician?
He will put him under test, maybe to see what exactly the problem is.
Pain in the chest,
Diagnose,
kahin
diagnose
asa
him
to,
thoroughly.
so he will see, no, kahin pain asa. Kalde
Sorry?
to ka?
Yeah, yeah.
Ah, so he will do an
Understood.
ECG, no, ma'am,
Yes, he'll go. Yeah.
to check whether it's a heart or it is just
Yes,
the
yes.
prawns which you had, fried prawns which you had, isn't it? Similarly, if there's any doubt on a child, screen the child or an adult. Don't hesitate. Just as you go for heart checkup, because there's a pain in the chest, there's pain in the mind, it's very important to really step. My dear friends, everybody is asking me, why has depression increased? I said disconnection, globalization, rapid pace. I don't know what we are running at. $1 trillion economy. Why? Energy is constant. So what does this $1 trillion economy mean? It means consumption. Buy a car, sell a car. Buy a pen, throw a pen. Buy a TV, change the TV. Get married, change your spouse. Unnatural. Absolutely unnatural. So the brain has not changed its size, shape, color, texture, volume, weight, and even the smell. But depression, which means what? Environment is changing. And what is very important at this point of time, my dear teachers, thanks for really joining early in the morning. It's beautiful weather in Bombay. It's like having bhajia, coffee, batata vada, and having a conversation. Mind is not made of iron or steel, it's made of neurons. Nourish it always. You need to nourish your brain all the time, and that is so important. Two answers for this slide. I would like anybody to answer. Anybody from anywhere. Please, my dear friends from Bombay, I'm not saying you should not. Huh? Anybody can answer. What does this slide show?
This lady is suffering from depression, Deepika
Ah,
Padukone. She's been diagnosed with
absolutely. What is important about
which
depression?
is
Anybody from Kerala would want to answer? Kerala, Tamil Nadu, Andhra Pradesh,
Yeah.
Karnataka, Namduru.
Joshi PM.
Pardon me?
Yeah, Joshi PM is from Kerala. Yeah.
Kerala, very nice. Come on, Joshi PM.
Yeah,
Hara.
I think she's depressed and
Lot of sangadam, no? Lot of sangadam.
yeah.
By the way, my dear friends, sangadam in Malayalam would mean what? Jojipian?
Yes, Sangadam.
It means what? It means what?
Sadness.
Sadness. Very true. So this slide actually means that fracture is visible. Sometimes depression is invisible. Here it's visible. So my friend says this beautiful sentence, which I would like to share with you, my dear friends, is that all those who are crying may not always be depressed, and all those who are depressed may not always choose to cry. So remember, sometimes they're silent. So depression can be very invisible, and you need to really look at. Suicide is not about courage or cowardice. And most of the times we say कितनी हिम्मत थी ना उसको, and वो हिम्मत हम इसीलिए कहते हैं कि हमें लगता है कि हम नहीं करेंगे. हम उनके पैरों के चप्पल पहनकर जब हम सोचते हैं तब हमें लगता है बहुत हिम्मत थी, which means we are normal. When we hear somebody who has ended their life, we analyze that in our own perspective and we believe that it is an act of courage. And sometimes when we are very scared, we believe it's an act of cowardice, but it's not true at all. It's all about the mental state. One mark quiz. Who's this actor?
Robin Williams.
Thank you. So it's all about the mental state. At that point of time, that person believes that he or she should go. Nothing is going to happen to the family. And family will cry for some time and the world will go on. And sometimes when kids come and say, "Mujhe dikhana hai mere parents ko," I want to teach my lesson to the parents. Such parents you should never say. Such kids should never say that your family will be very sad after you pass away. Remember the state of mind. No. Then they would say, "Yes, I would like to make them suffer. I want to die." When they are depressed, they say that. So you should never say that. It's about the mental state. So as somebody said, that don't really chase the root cause. We always are more interested in Moola Bhuta Karan. There's no Mool and there's no Bhoot. Now, again, a question to all my participants. If your principal says, please go and visit the hospital, one of our students has attempted suicide, he or she is alive, he's being treated. जरा देख के आओ यार, खबर लाके मुझे बता दो क्या हालत है. What will you do?
Go immediately.
And then do what? What will you do?
Go immediately and just be there for some time and see how it's going, and just be there and wait to see whether the person wants to talk to me, speak to the parents, whoever is around, speak to hospitals, depending on the situation. But generally be there and find out what has happened and see how we can help.
Acha, I would, other than talking to the person, I would refer to the person to a psychologist, a clinical psychologist.
Okay, thank you. What we need to do is, as Sohini said, be there. Being is more important than doing. Being is more important than talking. Be there. Let your presence infect the entire environment. Let him or her feel that you're wanted in the college back. Let him or her feel not small. And if the person talks whatever, listen to them. Never ask, "Tune ye kyun kiya? Why did you do this?" Never ask this question. Point number 2, see that he or she is not only seen by a physician, but also seen by a clinical psychologist or a psychiatrist to understand the intensity of the attempt, lethality of the attempt. Was it impulsive? Was it planned?